Thank you, Carla, for being here with us today. I'm so excited to hear you speak at our AGM, and we would love to learn a little bit more about you. Could you just start by telling a bit about your specialization in eye care, and also what your journey then at Moorfields has looked like?
Perfect. Thank you very much for inviting me. It's always a great pleasure to be part of the volunteers team and Friends of Moorfields. Um, I'm an ophthalmologist and I have a particular interest in complex anterior segment disease and structural complications, such as hypotony, which has been the focus of my work alongside Mr. Petrushkin, who is the uveitis consultant who had all the ideas about the treatment for hypotony. My work focuses on patients whose eyes have lost their normal pressure and the structural integrity. And this can happen after surgery, inflammation, or ocular trauma. And who are the frequently told that have little that can be done. I have a journey at Moorfields that has been deeply formative. It began not only as a clinician, but also as a volunteer. Initially, I was a volunteer at Moorfields Eye Hospital at the reception, and I was guiding patients through the hospital. So they could do the check-in, and I would guide them to where to go. And I was always there for um, questions. They could always ask any questions, and I think this shaped the type of doctor that I am today. Um, and it's very interesting that when you sit beside a patient without um, the idea of being a doctor, you hear different things about their fears of losing independence, their frustration, and their hope that someone might look at their case differently. And that perspective always stayed with me. At Moorfields, we are very privileged to be able to work at this intersection with this clinical excellence, research, and compassion. I'm very grateful that I've always been allowed to have the time to talk to the patients, even when I'm in a very busy clinic. Uh, and that I think that's what drives me and in the meaningful way for breakthroughs with science and care for our patients.
Oh, that's amazing. And you really phrased that so beautifully how it is at the intersection at Moorfields. But first, just circling back a little bit, because your relationship with friends has recently kind of gone full circle, which has been
Yes.
really exciting. Because as you mentioned, you're part of the Hypotony team that was recently on the news as well about this treatment that has been developed, and you actually treated our chief executive, Angela, with this new eye injection procedure. So for people who weren't at the AGM and who would like to understand a bit more, could you briefly explain what hypotony is and also how the new treatment benefits patients like Angela?
Of course, and it's been a great pleasure to be able to treat her. Hypotony is a condition in which the pressure inside of the eye becomes abnormally low. The eye is normally a pressurized organ, and it requires a delicate balance to maintain its shape and function. And when it drops significantly, the eye can collapse structurally, leading to distorted vision, changes in the retina, discomfort, and in severe cases, irreversible sight loss. And for many patients, this is not just a number, it means blurred vision, fluctuation in the vision, difficulty in reading, driving, recognizing faces, and often the emotional way of being told that the options are unfortunately limited. And then the treatment we developed involves the injections inside of the eye in the vitreous, which is the gel part of the eye. And it is with a viscoelastic substance like a gel that provides internal structural support rather than trying to do an attempt of increasing the pressure, putting in the liquid part in the aqueous, which is the front part of the eye. This approach focuses on mechanically restoring the eye's architecture from within. And then by stabilizing the globe, we can improve the retinal contour and visual function. So for patients like Angela, it represents something very powerful. It's a shift from there is nothing that we can offer to there may be a way to help. And I think this is really impactful.
Yeah, I think that's amazing, just being able to give people hope in that sense, for
Exactly.
something that maybe previously wasn't possible. It's so
Exactly.
incredible that this has been achieved. You and the team actually you trialed an existing solution for a different problem, and then this idea came, oh, why don't we treat patients with hypotony with this? Can you talk a little bit about how that happened?
Yes, of course. So
Yeah.
Um, innovation, I always believe it begins with listening carefully to what's not working. And in hypotony, the other conventional treatments, they aim to correct the underlying causes, but in still in some patients, there is structural unstable eye, despite everything that we do. And when you repeatedly meet patients whose lives are limited by a condition with no reliable solution, you start asking different questions. And this gel, the HPMC, has long been used safely in ophthalmology as a viscoelastic agent. And then the idea emerged from listening to a patient's concern. She was losing her vision, and then Mr. Petrushkin wanted her to have all he could do to avoid it. And it's incredible to see a doctor taking patients' concerns into consideration and creating a new treatment. And that's how it all started. Also, the persistence of patients, their refusal to accept deterioration, that deterioration is inevitable, plays a powerful role. When patients continue to have hope and they continue to come and they ask whether there is another possibility, it challenges us as clinicians. And then we need to look beyond established pathways. And then, in this sense, innovation is often co created with patients, which I think is very well allowed at Moorfields Eye Hospital.
We read the story in the news as well, that relationship, how you encouraged each other and how you came to that solution. It's just incredible to hear. And you've previously talked about sort of consultants really being the voice for the patient no one talks about. Um, and when we talk about unmet needs and how that drives innovation, and also in particularly, I guess, when we look at rare diseases and conditions like this, what role does that listening to unmet needs play in innovation?
Rare and underrepresented conditions
Yeah.
are often they often receive less research attention because they affect smaller populations. Yet for the individual patient, the impact is profound. When there is no established treatment, no large trial, and limited literature, us as clinicians, we must think more creatively and more collaboratively. And this has been done at Moorfields. So we don't work alone, we work as a team with patients. We work with different clinics, so vitreoretina clinic, electrophysiology, ultrasound, cornea clinic, glaucoma, different consultants, different colleagues, different people that always have something to add. And being a voice for the patient that no one talks about means recognizing that equity is not only about access, it's about attention. It's about ensuring that uncommon conditions are not dismissed and unsolvable simply because they are uncommon. With the hypotony, this is a good example. It began with a relatively small number of patients with a significant unmet need. Then, once you explore solutioning that concept, that principles may extend to broader applications. Historically, some of the most transformative advances in medicine began with rarer and challenging cases that forced us to think differently. And when we allow patients lived experience from fears and aspirations to guide these research priorities, then the innovation becomes purposeful rather than abstract. And then we can have something concrete and we can see the improvement. And it's incredible to see how happy they are that they have some hope.
Yeah, amazing. It just all sounds really exciting for it sort of to happen in the room and with so many different people, so many different voices, and that diversity of thought to kind of feed into new solutions.
Exactly.
And it's amazing that that environment exists, of course. Um, let's have one last question then, and just around sort of innovation at Moorfields. You've spoken about it so much. When you think about it, if you had to name one thing, what excites you most about innovation at Moorfields?
I've been thinking about that for a while, but to put in only one word, to me, is the mindset. At Moorfields, there is this culture that allows the clinician and scientists to question assumptions. We are not just satisfied with this is how it's always been done. We have the possibility to change. And that environment combined with exceptional research infrastructure and multidisciplinary collaboration, because we have so many incredible people working at Moorfields, this creates the space for meaningful change. But for me, I think innovation is not only technology, it is also relational. It's that the moment the patient who has been told for years that nothing can be done hears instead there may be something we can try. And then kindness and innovation are not separate concepts to me. Because we can genuinely care about the emotional impact of these diseases. And then you become motivated to do the search for solutions. And the future of the eye care is not only about new devices and molecules, it's about maintaining the human drive to change the outcomes for patients who feel forgotten or unseen. And that, I believe, is where the true progress will begin.
Oh, amazing. Thank you so much, Carla. That was such a beautiful summary of everything that's happening and also the sentiment around what innovation means at Moorfields.